Okay.
Jessica.
Yeah, it's my name. That's my name. Hi, everybody. I am Jessica with BCID.
And my name is Jose Hernandez with United Spinal Association. Today we have a full house with Milenka from the Brooklyn Center the, for Independence of the Disabled,
Get it right.
um, and their community health CHW workers program.
Yep.
And before we get into the program, Jessica is going to go over some housekeeping rules.
Yes, yes, yes. If you guys have any questions, you can go ahead and put them in the Q&A section at the bottom. Direct questions, and feel free to chat amongst yourselves in the chat box. But for questions, please keep them in the Q&A just so we can get to as many as possible and it's less confusing. You guys are only in panelist view, so we can't see or hear you at this time. And we have Mary with us today. If you would like to see Mary only, you can go ahead, right click and pin her.
Also, if you need closed captioning services, you can click on the closed captioning button down at the bottom of the screen, and we're using a program called Otter AI for live transcription. All right, so with that said,
Milenka.
Milenka, please introduce yourself and your crew.
Thank you. Thank you, Jose. Actually, I want to thank you and Jessica for inviting us. So we also have 3 of our CHWs here, Maria de la O, Richard de Vann La Russo, and also Angel Valentin. And they'll be sharing some experiences later on. So first thing I want to say, I am, of course, I head the program. Our CHW, or Community Health Worker Program, is funded by the Mother Cabrini Health Foundation. We have a great team of trained CHWs with disabilities. And the program serves adults with disabilities and chronic conditions, and service is free and statewide. So let me just pose the question, who is a CHW? In our program, through weekly calls, a CHW provides peer support, links and resources in the community, and helps the participant navigate the healthcare system. For example, someone needs a new wheelchair or needs a particular kind of prescription from a doctor. They may need guidance to know how to proceed, and that's where we come in. But what I want to emphasize is peer support. Peer support means the ability to express empathy for what a person is going through. So the relationship is more intimate, like having a professional friend, I like to say. Unlike a medical model, when the disabled person may be told what to do or there's a false distance between them. Our program is unique because our CHWs are disabled and they know firsthand what obstacles their participants are facing, whether it's with employment, accessibility, or discrimination. So a CHW can be a peer, a role model, and an advocate all at the same time. Being a CHW is also actually a perfect accessible position because, well, here you can work from home. And ironically, disabled people are being hired now during the pandemic when so many others have lost their jobs. But it makes sense because we disabled people are accustomed to problem solving and dealing with obstacles every day. And, you know, CHWs are more and more in demand. Health providers are actually hiring CHWs because it's been shown, the CHW programs have been shown to be cost effective and also have a big impact on one's health because we're addressing what are the social determinants of health. For example, whether it's transportation, employment, housing, And these, in fact, have more of an, how should I say, an impact on health sometimes than even just medical care. I want to share with you that, well, there can be real opportunities being a CHW. In our last program, we had 2 CHWs who moved on to permanent positions. One became our accessoride advocate at BCID, and the other became actually, Jessica had your position of systems advocate also at BCID, and then she moved on to be a disability advocate for the Taxi and Limousine Commission. So we're very proud of that. So I'm going to turn it over to the CHWs now. And I would like you to share an experience working as a CHW. Richard, why don't you go first?
Yes, good afternoon, everyone, and thank you very much again for attending. I am working with an individual who is working on improving his mental and physical health during the pandemic. But when he attempted to participate in activities, he got a negative reaction. And this made him very frustrated because his ability to make decisions to take care of his health was not respected or taken seriously. So we found a support group that he was very happy with and that he decided to join. And through the support group, he was able to express his feelings and ideas, and he was able to get positive feedback from the members. And so we're continuing, right now, we're continuing to work on continuing to improve his confidence in advocating for his needs, and we're also working on effective communication.
Thank you, Richard. And what I'd like to add, I think, and what is especially great is that you attended, if I'm not mistaken, the first support group meeting with him to give him more confidence, right?
Yes, I attended the first group to support him and just to introduce him. And he was received very well. I kind of stayed for, maybe half the meeting or so. And he was received very well. And as it turned out, he had a lot of interest that other group members had. So he made an instant connection. He had an art piece on his wall that people in the group recognized. And so he got to talk about that. So it was kind of a good icebreaker for him. And it was a good connection. And created a kind of an immediate positive environment for him.
That's really, really great, Richard. Thank you. Maria, why don't you share an experience with a participant of yours?
Good afternoon, everyone. Thank you for allowing me to be here. It is my pleasure. I am a bilingual CHW. I have been working with a young man who is Hispanic, legally blind, due to a neurological problem. And when I met him, when he joined our program, he was not too happy because he was having a lot of issues. He didn't know how to navigate the government, health, social services, and even the college special services program. I am happy to tell you that he is now doing excellent in his college. We recently were able to assist him to recertify with some of his benefits, including Social Security. He didn't know how to go about making appointments with some of the doctors because of the pandemic. He was only used to going in person, calling, and due to the virus, he was not able to do that. So I teach him how to navigate, how to call and do it online. So he was able to see to make the appointments and take care of the test. And on top of that, he needed a computer to do his schoolwork, his college work, and other things. And we were able to find a donor, so he was able to receive a new computer, as well as some of the other program members and some of the staff members. He's about to graduate from his associates, and he hopes to eventually maybe become part of our program in the future, because he's very pleased with the service that we have given him.
And well, he should be. And Maria, thank you so much for your advocacy, because without you, we wouldn't have had those donations of computers and smartphones.
Thank you, it's my pleasure.
Yeah, that's so great. And by the way, you mentioned being Spanish speaking. We are very proud of our diversity, and we have several people who are bilingual on our team who speak not only Spanish, but also Creole and Arabic. So that also adds to being able to reach many people out there. So Angel, your turn now.
Yes, first off, I would like to thank everyone. Thank you for this opportunity. I am currently dealing with a young man. He's 24 years old. He graduated from high school. He's been in and out of hospitals and institutions due to his disability. He has spina bifida, and he constantly gets infections because of his spina bifida. So I've been working on him to learn how to prevent hospitalizations and get him active again in the community, which he thoroughly enjoys to do. He misses it immensely. He's trying to get physically fit, so I've been teaching him methods and techniques on how to get physically fit, as well as improving his diet to better his life in longevity, in order to stay out of the hospital, to allow him to further his goals, which is eventually go into college. He is thinking and hopefully in the future having his own apartment, but at the moment all he's concerned about is just getting stable in his health, and that's what I've been working with him in doing, and he's progressing nicely. He's understanding the goals and the things he needs to do in order to stay out of the institutions and hospitals. That's all pretty much I have to say at the moment.
Thank you, Angel. Angel is very dedicated and works really hard on goals. And I want to say that the program is person-centered or participant-centered, if I can say, in that it's the participant who decides on what goals he or she or they would like to address. And so we're proud of following with that kind of approach.
I got a question. I have a question, Milenka, if I can.
Yes.
I know that you guys are doing great things and motivating individuals to, become independent. But I want to ask the CHWs a question. Because you're helping these people, how does that make you feel personally? Knowing that you're helping people.
That's great. You're asking the very question.
I took your question.
Yeah, right.
Can I
Sorry.
answer?
Sure, go ahead. Mm-hmm.
I come from a very clinical model. I'm a substance abuse counselor. So that transition of impersonal, I had to readjust to become formal. My mindset was more clinical, and I wasn't really accustomed with connecting with people on the level that's needed right now. So I'm learning that by me connecting with somebody on this level, which is different from clinical, I'm able to do more effectively my work because I'm connecting more and the person is receiving what I am trying to convey.
Okay, yes, you have shared quite a bit of insight during the trainings. So do you enjoy this being connecting with people on this level?
Absolutely. It's something totally unique and totally different from what I'm used to.
Mm-hmm.
before I used to come from a clinical model where you help somebody, that was it. You never connected with them on this level.
Exactly. Thank you, Angel. Anyone else? Richard, would you like to answer the question?
Yes. Well, I feel that we're helping each other. We're a part of the same community. So you know, for success for one is success for all of us. So that's the way I feel about it. We're kind of helping each other, and we're also, one of the things that I feel is important is that, you know, as we work with people, we're getting to see how the system works. You know, they're trying to receive benefits or services, and they're trying to get in touch with people using hotlines and, you know, just navigating the system. So, you know, as advocates, we're that's kind of testing out how the system is working, so that, you know, we're working with people who are using, you know, actual experiences that we're using as well. But also it kind of gives us information about, you know, in a systems advocate way to, you know, direct to other people. Like there's, you know, we have an opportunity to go on the mayor's call each month. So, and they want to know about glitches in the system. So this is a good opportunity for us to, you know, give them the experience of other consumers and other people with disabilities and their experiences and what they're dealing with and trying to navigate the system.
Absolutely, and now with the pandemic, it's so much harder to get the services in place. A lot of agencies are working remotely and are hard to reach, and also all the more that people, disabled people, need our services, though, need the peer support at the very least because of the pandemic and so much isolation. So now who has it? Maria?
Well, in my case, I kind of I love it when I met my member, because in a way I can see a reflection of who and how I was years ago. I went through a similar situation. Unfortunately, I was not aware of, you know, these services. So I used my personal experience to help him and to try to mentor him. And also, like Ms. Milenka said, during these difficult times, he has expressed that he feels a little bit lonely, lost, because he's studying from home. So he enjoys talking about all the different things, especially about college with me. And in my case, I also love it because I get to practice my Spanish.
Right, and I want to add something here. It was I assign the CHWs, and I go quite a bit by chemistry. I think he'll be a good fit. Well, here though, there was a concrete decision to be made between Maria and another CHW, because the participant you're talking about, Maria, is visually impaired, but his native language is Spanish. So I asked Maria to check with the participant and what he would prefer, and he decided he wanted Maria and who's Spanish speaking. However, as time progressed, he was asking for resources for people with visual impairments. And so then we had an interesting solution. We had the other CHW join Maria and the participant in a three-way call, and where the other CHW gave him many resources. And he was, remember Maria, he was so pleased.
Yes.
So very pleased. So that was great. That was great. Are there maybe other questions? No? Okay,
I was gonna ask something.
yes.
Do you ever find like sometimes it's frustrating, maybe like if you don't find the answer or a solution to, you know, what these people are looking for, and how do you deal with it? Like, what do you do to help find like a middle ground, I guess, so to speak?
Can I answer that?
Absolutely.
I find that the resistance comes from the participants themselves because they're so let down by the different systems of New York that they're resistant to receive any help because they believe that we might not be able to help them. But the better prepared we are as CHWs and show them that we can, the more at ease you put the participant. That's where it all begins. That initial connection of, I know what I'm doing, I have everything you need, and you show them, not just say it, but show them that you can, that puts people more at ease to accept what you have to provide.
Angel, I would add, however, that there are times where we do try and we are not able to find a solution. That does happen, and we get very frustrated, and so does the participant. And we just forge ahead and continue to look for more resources or help. The BCID has a benefits counselor on staff, for example, or we know of other resources as well to try and solve these problems. For example, someone really has come out now from the hospital, had surgery, really, and I guess there was no social worker who to set up any program for him. He really needs a home health aide, but he doesn't have Medicaid. And that's a real problem. So then you have to start the, applying for Medicaid. And in the meantime, he's not getting the help he needs. So there are very frustrating situations. And also, I know he needs, he had Meals on Wheels before, but that service was interrupted because of hospitalization. So we're trying to get the process going again. Anybody else would like to add to that? Maria or Richard?
Well, I think the frustration is, I mean, what we do is also, help participants cope with that. I think that's reality. This is just the reality of the way things are. And I think like having, trying to work on coping strategies to try to minimize that frustration or look for alternatives is something, just to have them to, just to be there to listen to them and allow them to talk about that kind of frustration, just to have another ear to listen to, can be a relief in some way. To have somebody to listen, and things might not be as bad as they are if there's somebody to listen to and try to help you to, kind of work it out and try to cope with the situation.
Absolutely, and to know that you're there working on together, working on finding a solution, I think.
Yes.
Maria?
Yes, I would say like before, many times I found out that there are very small problems, like for example, with another member, he was not aware that the problem was that he wanted to change his pharmacy. And he thought that he needed to go to the doctor just to do that. And I told him that all he needed to do was call the insurance or call the pharmacy, and that he wanted to use and request, that he needs tell the doctor that he needed to change the pharmacy. And he was totally not aware of that. And another thing was that, for example, I use a personal example of certain situation, and he thanked me for that because he learned and he was able to take care of that other situation. So many times we use, by using our personal issues, experiences, we are able to assist them to resolve their problem.
You know,
And I'm sorry.
no, I was just gonna say the reason I asked that is because, like, myself, I get frustrated. And like the other day, I was having a problem with my chair, and I needed some repairs, and it's this whole long story. But I know, as we all do, a person with a disability, it can be exhausting to have to always like fight and advocate for the simple things that we need. And like, just I didn't feel like taking the time that day to just call the Department of Health and make a complaint. Like, I was just like, today, I just don't have the energy to give to this. This is exhausting. I am mentally and physically frustrated. So I can imagine having you guys there for moments of people like me when they get frustrated like that. That extra boost can be helpful, you know?
Absolutely. And what I think is also good is that, like Maria gave the information, but he, the participant, followed up and so self-advocated, which we try to encourage.
Sometimes they just need a little push, that someone to remind them, to tell them you can do it, or this is okay, there's a solution for it. That can, that's all they need.
Then there's the reality, Angel, of being on a three-way call to, was it Social Security for 3 hours?
Yes, it was 3 hours. And just waiting there. Unfortunately, my participant got tired, and they said, let's make the call another day, because it was 3 hours straight of just hearing the office music go off in the background.
So, but we also planned to make the call like at dawn, so that you will next time get through.
I just wanted to say something else, that because we have disabilities, because we have conditions, it prevents us from actually doing the work ourselves sometimes. And we do need that assistance to be guided into the systems and learn everything about how to get a simple wheelchair, or how to go see a doctor, or medical conditions that you might not be aware you have. We can bridge that gap between the provider and the patient or the participant.
Well, with that being said, I'm going to pose another question to everyone here. How much do you lean on your own experience as a person with a disability helping your participants? Because I know, because of the nature of where Milenka works and the whole independent living system, a lot of the caseworkers and the people who work there are people with disabilities. So, there's a lot of experience. So how much do you guys lean on that?
I would say a good 30% of my experience I use, but I don't play like I know everything. I just try to learn as much as I can in order to assist the participant in whatever need they have. I don't promise anything. I don't assume I know everything. I plan ahead so that way I'm prepared for the participant.
What about you?
We also have weekly meetings, bi-weekly meetings, so that we can discuss and we try to help each other. Like Angel said, no one knows everything, and we try to exchange resources, personal experiences, and that's how we often are able to solve the situation and help our clients or members.
Absolutely. I have such a blessed
teamwork.
I have such a blessed team to work with, a good leadership. I can't ask for anything better. You've been extremely helpful, more than I can even express.
We really do have a great team, and yes, we have our bi-weekly meetings where we share our experiences, and we come up with we brainstorm. But in answering your question, Jose, I think that you certainly all use your experiences as a disabled person in terms of facing, you understand about all the barriers we face, no matter what, no matter what the disability, but you have your personal experiences working within the community and the system, right? Richard, what do you have to say?
I just wanted to add that in conversations and listening what the participants are going through, there are times when things come up that my personal experience is very similar. So in those situations, I try to use that in an empathetic way. It helps me to do that in an empathetic way because I also have experienced it. And, sometimes how I got through it or how I dealt with it also, helps them to try to assist them in dealing with what they're going through.
Absolutely. Mm-hmm. It takes one, it's a skill to be able to connect with someone. There are many skills. One main one is active listening, which Richard, I think you are an excellent example of that. We also, by the way, aside from weekly calls, there are progress notes to write. So documenting what's going on, and we can see, the progress being made, or how the relationship is moving forward. So, in any case.
May I add one more thing?
Absolutely.
One of our members has mentioned that we should have been considered among the first responders during the epidemic because, for example, he said that he had made many calls and no one was helping him, and he feels that that we saved it, that we are the ones who came to his rescue during the pandemic. So that was very nice to hear from someone. That, makes me feel that I'm doing something right, and that, since I was a teenager, I love doing this work because it's, I enjoy hearing things that are making someone's life easier, and also being an example, using myself as an example, that just because you have a disability, that doesn't mean that, you're not capable of accomplishing whatever you want.
Thank you, Maria.
I mean, this pandemic was definitely a beast and something thrown at us very foreign. And I know that one-on-one, even talking to people, especially early on, is super important. So I'd say I have to agree with that person who said that to you.
Mm-hmm.
Have you guys found any challenges in connecting with people throughout the pandemic?
Anyone?
I would just say it's more about attitudes and building self-esteems and getting the participants to think positive in this time of need, because that weighs a lot on people's minds, knowing that they have underlying conditions and they could get sick from COVID very easily, more than the regular population.
And also just the increased isolation, is very difficult on people that are already staying home for the most part. And as somebody said before, they really look forward to that weekly call and that connection.
Another thing is sometimes they're a little bit, they were impatient at first and frustrated because, as we know, due to the COVID, many organizations. Many people are working from home. Sometimes they get they have to be on hold, or they are not some of them don't have a computer or a smartphone, so they don't know how to apply for certain services. And you know how many doctors nowadays, they are doing virtual visits, and many of the members don't have a smartphone or computer and don't feel comfortable doing that. So that's sometimes very frustrating.
There's even the challenges of having access to broadband internet. You know, a lot of the consumers, or I'm going to make the assumption the participants that you work with don't have access or live on a fixed income. So purchasing, broadband internet at $50, $60 a month is something that's outside of their budget. So maybe that will change in the future.
Yes.
Absolutely. That's always an issue with the disabled population, where they lack the resources and the knowledge of things available to them, because there's no program extending that olive branch to say, we can help you in this area. So we're bridging that gap to some degree.
I think one of the challenges that I faced was dealing with the situation with home care, individuals who are in need or are receiving home care. That's there's a lot of so some difficulties that individuals are facing with that, either threat of losing it, or not having the relationship is not that good, or one individual had home care, but there was a situation in his home that after all the trouble getting home care, there was a situation where he was no longer able to have home care, and that was very frustrating. So I would say, it's such a fragile situation with home care, and there's such a need. Individuals have such a need for it, and it helps, in terms of their, ability to, function as best they can in the community. So that's a big challenge.
For sure. And you've also worked with someone who was transitioned from a nursing home to back into the community, which we have also a great program called Open Doors. But this person, so normally there are peers and other supports, but this person in particular needed the extra support, and you've done a great job with her.
Thank you.
I wanted to make sure that we get it in there that, we still got room for more CHWs and for participants. So Milenka, if you want to go ahead and touch on that a little bit.
I'm sorry, Jessica, you were saying about our participants?
That we still have room for more participants.
Oh, yes, we certainly do. We are growing the program, but with the pandemic, it's been challenging to get the word out and to have, I'm sure there are many people out there who could benefit from the program. So yes, we have our flyers, and I wish we also had our other CHWs, those that speak Arabic and Creole, and are reaching out to those communities. Yeah, so if you are interested, if you have a disability or a chronic condition, or know of someone who does, or if you are interested in becoming a CHW, you have our information there on our flyer. Please get in touch with me. There's my number, or you can email me, and that would be great. Thank you.
Yep. just for verbal, I'm just gonna read it out loud. The number is 929-219-0960 for the CHW program, or you can email chw@bcid.org.
Thank you, Jose.
You can close out now. Dear, thank you.
Stop screen share.
Yes, so anything else you guys want to share about the experience or?
Well, it's been great for me, starting the program from scratch and, finding the right CHWs and the trainings. And I have a wonderful program assistant. Yeah, so it's it's been about a year or more. And we want to continue the program.
Great. It sounds great. I'm telling you, I needed you guys last week when I was all huffy about not wanting to make the phone call. Yolanda, we got a question. She asked if there are BCIDs in every borough. There are independent living centers, and you got Bills. Bills is for the Bronx, right? Yeah, Bills.
Right.
You got Sydney. You got BCID.
And Harlem Independent Living Center.
Harlem, HILC.
But in terms of a CHW program, I think BCID is the only one. Though in Brooklyn, though, we serve all the boroughs and in fact the whole state. So yeah.
And really quickly, before we hop off or get to any more questions, I just wanted to say that we are doing a bunch of legislative meetings as of recent. So if anybody is interested in also participating in that, you can go ahead and send me an email. I will go ahead and put that in the chat box, but it's j.delarosa@bcid.org. Anybody else?
We have one question. This is, what are the outreach efforts to inform prospective participants of your services? I guess you guys went over that with the flyer.
Right. And aside from the flyers, though, we've had our CHWs reach out with them in the communities. We've also posted on Facebook and Twitter. We've also just made calls to disabled organizations, providers, and just try. In fact, one good connection we've had is with a social worker at SUNY Downstate who's given us a lot of referrals. So we were trying to reach out to other social workers because that is a good connection for us.
We also use the local, the community services like car service in some restaurants and offices.
Yes. A lot of cab drivers come from different communities and they know of people who need help.
Yes.
Sweet. So if anybody else has any questions, comments, suggestions, I'm going to pull one from Joe's book and say a joke because I could use one.
Yeah. Oh, I thought you were going to come up with a joke.
No, I need one today. So. Okay.
Well, if there aren't any other questions, Jessica,
No.
you guys have any last thoughts, any last comments?
I just wanted to say that when we it's really exciting when we, when we provide information or resources to an individual. It's really exciting to kind of see them take that information and just jump off with it, to really advocate and, work as with us as well, to really do a lot of the work on their own, and to see the success that when they see a little success that they're getting, and the excitement that they're getting out of it, and then they'll continue to process. And when something works out and is successful, to hear that and to go through that is wonderful. I mean, they'll say like, oh, no, it's okay, I'm doing well. When you hear that, when you get a weekly call and they're saying, oh, yeah, I took care of this, I called Social Security, whatever, and I'm doing well. That's really gratifying to me, and I'm sure to all the other CHWs to have them, follow through on our efforts and to continue to be successful in reaching that goal.
Absolutely. Absolutely. That is such a great feeling when that goal has been achieved and they've played a part in it. And it's very satisfying. Yeah. Mhm.
I just wanted to bring awareness and thank you for this platform to be able to talk about our program and the need within the disabled community. To anyone that works with people with disabilities, please keep in mind that we're not just a number. We're also individuals with a lot of needs, and please try to cater to us the best you can.
Well, I want to thank again, Jessica and Jose for having us. And I want to thank also Maria and Richard and Angel for contributing their experiences. That was great. And I wish we had invited more CHWs because it was hearing those personal experiences, you can really see what kind of work you're doing. So.
Thank you, for giving us the opportunity to present or give you guys a platform. It's great to hear.
Thank you.
Thank you
so much. Be well, everyone.
Thank you.
Thank you, guys. Richard,
Thank you.
I see the cat. Take care, guys.
Take care.
Thanks.
Take care.